All right. Welcome, everyone. I'm watching the participant list grow, but it looks like it's slowing down again. So it looks like people are getting into our session. So let me just start off by saying hello. My name is Dawn Ramsberg. I am the Division Director for Program Operations in the Office of Child Care. And so we're happy that you're here to join us today. We want to be able to talk specifically about the Triennial Child Count requirements for the Child Care and Development Fund program with tribes who have an approved Public Law 102477 consolidated integrated plan. And there might be a few folks perhaps here today that don't have an approved plan yet, but who are thinking about applying this time. So hopefully today's session will help us all be on the same page as far as what is needed to get the CCDF funding so that we can continue our partnership with the Department of Interior under the Public Law 102477 work. So let me, if we can go to the next slide, let me talk about what we're going to cover today. So we will talk about what is needed in order to apply for CCDF funds. So our law is the Child Care and Development Block Grant Act, and it tells us what we need to apply, what tribes need to do to apply for CCDF funds. We'll go over child count requirements, which is one part of that application, talk about the definition of Indian Child and Service Area, which is part of that child count submission, talk about data sources and considerations for conducting that child count. We will talk about our CARS system, Child Care Automated Reporting System, which is where this information gets submitted. We also wanted to give a couple of updates on some rule changes. So as you are working on your 477 plans and in kind of your program as a whole, we want to talk about some CCDF rules that changed over the last year and how you might consider those as you're developing your plan. And then we'll briefly touch upon plan amendment and review. So if we can go to the next slide, I'm going to just talk about applying for CCDF funding a bit more. So under the CCDBG Act, which is the short way we talk about the Child Care and Development Block Grant Act. So that's the law that authorizes the CCDF program. And so as part of that law, lead agencies, specifically tribal lead agencies, are required to apply for CCDF funding every 3 years. So the current funding that tribes have been getting based on plans, any plan that you've had in effect going into this year, that funding authorization expires September 30th. So, we need, in order to be able to authorize funding, program funding, we need to have this application every 3 years. So I'm going to talk a little bit more about what that application looks like, especially depending on where you might be with 102477. So if we can go to the next slide. And again, this was in the program instruction that we put out at the beginning of 2025. And this went to all tribes, but there was a section in there specifically about any tribes that have already consolidated, meaning that you already have an approved Public Law 102477 plan, and that plan is not expiring September 30th. So maybe you were approved last year, you might have been approved a couple of years ago. So anyone whose 477 plan is not expiring September 30th is gonna, you're gonna submit this request and this child count by July 1, 2025. And so what this funding request is going to include, and you're going to do this in CARS, is you're going to complete the declaration, and that child count declaration basically just says that you are requesting, that you are requesting program funding. And so you're going to complete that declaration. And then you're going to upload the following information. So again, you're going to request to apply for CCDF funding. You're going to provide an assurance to us that the tribe intends to continue providing services under your CCDF, the part of your program that was in your approved 477 plan. You're going to assure us that you're going to continue to provide those services. That request and that assurance could all be a letter. It could be the same document. Those don't have to be separate. You are also going to provide your approved 477 plan. So again, this is part of your application for funds. So you're gonna, you're gonna request, you're gonna assure, you're gonna, that assurance is gonna be tied to that approved plan. And then if applicable, if you are proposing any changes to your 477 plan, you can let us know. But we also just want to note that may require you to do a 477 plan amendment. So again, this was what is in our program instruction. This is what went to all tribes. This is what we need from an application. And so, like I said, this can all be one document, but this is what we need from the 477 plans or 477 tribes. And then if we can go to the next slide, because like I said, right, this is what the previous slide was about. If you already have an approved plan and that plan is not expiring September 30th, that's the list. Now, depending on kind of, again, where you are in your 477 plan cycle, if you are a tribe who is not currently 477, and meaning you don't have an approved plan, but that you are looking to integrate CCDF funding into a 477 plan that would become effective October 1, or if your current 477 plan is expiring as of September 30th, again, we're going to need that request for funding. You can submit the draft 477 plan that is being submitted to BIA with your CCDF funding application, and then that assurance. So we could basically, what this is saying is we can kind of take your intent to integrate, meaning that you've submitted a plan, and consider that so that you do not have to fill out the whole CCDF plan in addition to that 477 plan that you're submitting to BIA. But we would still need this submission in CARS. And then we know that there might be some tribes that maybe are looking to consolidate their funding into 477, but it maybe is not going to become effective October 1, like maybe you're looking come January. For those tribes, we would still need the CCDF plan, because at the time that this current funding expires, meaning September 30th, one way or the other, we have to have an approved plan to go with that. And so if you're not looking to consolidate until sometime after October 1, we would need the CCDF plan to have an authorized plan as part of your application for funds. So it's a little bit of navigating some nuances, and we know that there are people on different parts of, in different places. You either already are approved and we already have an approved plan, and you're gonna, provide us a few pieces of information that kind of go along with that, versus people who are coming in new or whose plan is expiring and you're needing to renew it. There's some different pieces. And so we just kind of wanted to ground everybody there before we go through explicitly then what the child count would be. So I think with that, I get to turn it over to Mike, but I'm also going to keep an eye on the chat and am happy to answer questions either as we go or at the end. So Mike, I'm going to turn it over to you.
Awesome. Thanks, Dawn. And hi, everyone. My name is Mike Kolbita. I'm a program specialist with OCC here in our central office, and I work in the policy, data, and planning division. And my role is I work on all of our tribal and construction policy. So also had a chance to work with many of you back in my former role in the Region 10 office. So it's great to see all of my Alaska people on the call today. And just really quick before we get into this slide, there was a question in the chat about what CARS is. And CARS is kind of like our internal data system where you're going to submit your child count. And we'll get into more of that later on in the presentation here. But as Dawn mentioned, the child count is a piece of this funding application that we need every 3 years under our statute. And so all tribal lead agencies, including those that consolidate CCDF into a 477 plan, must submit a self-certified count with the number of children who meet the tribal lead agency's Indian child definition and are under the age of 13 who reside within their tribal service area. And so when you're making your declaration, you do not have to submit your data sources to us. We'll get into data a little bit later on and how you conduct this count and get this information to submit your child count, but you do not have to submit that to us. Really, we're looking for that number of children within your service area under the age of 13. This child count, like I mentioned, is going to be based on two definitions that are going to be within your 477 plans. And that's going to be your definition of Indian child, which is kind of that baseline definition for who is eligible for your program. So do you serve all Native children? Do you serve only enrolled tribal members? And there's lots of different ways that you can tailor that to meet the needs of your communities. And then that second definition that your child count is going to be based on is your service area. And so we'll get into both of those a little bit later on, but they tie in with what is listed in your 477 plan under the CCDF section. The really important thing about the child count and why this is a super important thing that gets done, it gets done before the deadline on July 1st, is that this is the number that we use to determine your CCDF funding. So this will set up your funding levels for the next 3 federal fiscal years until we get into the next CCDF plan cycle. Okay, we go into the next slide. Okay, so when you're doing your child count, like I mentioned, you have the flexibility to determine your methodology and your data source. And there are lots of different ways that you can pull this data and figure out the count that best meets the needs and supports what your Indian child definition is. Tribal lead agencies must confer with any other tribal lead agency who has a neighboring CCDF service area. So if your tribal lead agency overlaps service areas, so let's say you share a county with another tribal lead agency, you have to confer with that other tribal lead agency to make sure that children are not being double counted. One of the requirements around child counts is that it's an unduplicated count. So the same child cannot be counted in multiple lead agencies' child count submissions. The other really big thing with the child count definition and why you're going to want to make sure that your methodology is sound and that you're getting the best numbers that you can to support your definitions is that you cannot change your child count during the 3-year child count cycle. And the only exception to that is if you are a consortium lead agency and you have a membership change. So that's the only time that you can change your child count within the 3-year period. Okay. And the next slide. Okay, so I mentioned a minute ago that the child count is really the basis for your funding levels. So we're going to talk through these next 2 slides here, where to kind of see how that impacts, right? So CCDF has a limited pot of funding, right? And so from that limited pot that were authorized by Congress, there's a set aside that goes to tribal nations, right? So for fiscal year 2024, that set aside is just under $600 million. And that $600 million is that set amount of money that we have to serve all 264, soon to be 265 tribal lead agencies that have CCDF, right? So if you think about it, right, you have the discretionary base amount that you get, but then all the rest of that discretionary funding is based on your per child amount, your child count. And that is the bulk of that $600 million. So what we do is when we get the child counts in and the set aside is set up, we kind of break that down. We set aside the discretionary base, and then everyone is allocated whatever their per child funding is. And that's what makes up your funding. So if we can go on to the next slide, we'll look at this a little bit differently. So you see in that first submission and child count 1, up in the middle of the screen there. Tribe A has 100 children. Tribe B is reporting 200 children, and Tribe C is reporting 500 children. And now we're using an example of $100 million tribal set-aside allocation. So in this situation, Tribe A with 100 children gets a $12 million grant. Tribe B with 200 children gets a $25 million grant. And then Tribe C with 500 children gets a $62 million grant. But now we're 3 years later, and we're on the child count submission number 2. And Tribe A has changed their definition of Indian child to include more children, right? And so you see Tribe A's child count with that same $100 million set aside went up from 100 children to 400 children. While Tribe B and Tribe C, their child count remained the same. And so what happens here, since there's that same set amount of money, that $100 million, that's divided proportionally among all the tribes. So Tribe A's allocation went up from $12 million to $36 million, while Tribes B and Tribe C's allocation actually went down because it's split up again proportionally based on the total number of children. So this is really important. Not only when you're figuring out your data sources to give you the count that best meets what your Indian child definition is, but also in understanding that your count not only impacts your tribal lead agency, but also impacts all other 264 tribal lead agencies. So it's really important that the data that you are using is complete and accurate. And we'll get through in a little bit how to talk through some of that. Okay, so when you start this process of how to conduct your child count, right? I mentioned it's going to start with the definitions that you may already have in your 477 plan, and that is going to be the definition of Indian child and your definition of service area for CCDF, right? You can change these definitions throughout your plan period, right? But remember that your child count is fixed in time. So once you submit your child count in July, you can't change it if you later increase or change or expand your definitions. The only time that you can do that when it really impacts your child count and your funding levels is at the time of the child count submission. And so once you have and you look at your 477 plan and you decide, do you want to keep your definitions or do you want to change them at all? If you change them, it would most likely require you to work with BIA on an amendment. But once you make that decision, that is when you really identify any existing data sources and start to work through that child count, right? So you want to look through your data, and then once you have your data and you are like, okay, this is the number of tribes or the number of children that I'm expecting to count. I spoke with enrollment, I pulled census data. If you have any tribal lead agencies that you either overlap or neighbor their service areas, this is also when you're going to want to be working with them and coordinating with them to make sure that you are not duplicating your child counts. And once you've gone through that whole process, which you have about 40 days left to do, that's when you go into CARS and you submit that child count. So most of the work with the child count is done in the preparation phase, gathering the data, conferring with any other tribal lead agencies. The actual submission process itself takes about 5 minutes. And then if we can go on to the next slide. Okay. So I keep on mentioning there are these two components to your child count, right? There's your definition of Indian child and then your service area. And so tribal lead agencies, again, who consolidate their funding into an approved 477 plan are going to have these definitions already within your plan. And again, you can change these as you're doing your child count, but you're going to want to work with BIA to see if that would require an amendment for the plan. And we'll get into each of these terms here in a second. We can get onto the next slide. Okay, so you are, again, when you are required to provide your definition of Indian child in your 477 application or 477 plan. And so any child who is going to receive CCDF services must meet this Indian child definition. So if your Indian child definition says, we provide care to, or we only consider members of our own tribe to meet our definition, then you would not be able to serve children who may be enrolled in other federally recognized tribes with that definition. There is broad flexibility in how you choose to define in the term Indian child, right? So you can choose to define it as, again, just member of your own tribe, or you could say you can define it as things that any child who has American Indian or Alaska Native ancestry is enrolled in other federally recognized tribes, has a birth certificate or some documentation documenting lineal descent from an enrolled member, right? So you have broad flexibility in how you do this. One of the few restrictions is that it can only be children who are affiliated with federally recognized tribes. So there are lots of states that have state recognized tribes. And unfortunately, because it's federal funding, it is only available to children who are affiliated with federally recognized tribes. And then if we can move on to the next slide. Okay. So that other big definition that you're gonna want to look to your plan for is service area. So CCDF requires tribal lead agencies to set up what's called a service area, and that must be on or near the tribe's reservation. For tribes that do not have a reservation, it can be set up within a reasonably close geographic proximity to where the tribe's population resides. And so within that, again, there is some room to define your service area in a way that best meets the needs of your community, while keeping in mind that there are those statutory requirements that the service area be on or near the reservation or within that close geographic proximity. When you're determining your service area, it's important to remember that there's an expectation that tribal lead agencies who claim an area as a part of their service area are able to provide services to families throughout the entire service area. So if you're expanding into a new county or you're looking to change your service area at all, there is that expectation on behalf of OCC that if you are considering that area part of your service area, you are able to serve families who reside there. So it's important to consider things like where CCDF eligible families reside and work and are needing childcare. If you have a tribally operated center, it's important to consider the proximity that you might expect families to transit every day to that tribally operated center. Again, if you're looking to expand your service area into a new county, but you only have a tribally operated center, is it realistic that that family drives to and from that center every day? You're going to want to look through the types of providers that your tribal lead agency uses. So for example, if you have relative care, center-based care, family child care, that you're able to offer that throughout the service area where it's applicable. And also along those lines, your own internal administrative capacity to monitor providers, right? You're still going to have to do those annual monitoring visits for health and safety topics with those childcare providers. So is it realistic that your staff are able to get out to that location? So one of the other things I think to keep in mind here is that ACF cannot approve an entire state as a tribe service area. And again, if you are going to base your service area on a close proximity, you want to make sure that it is not too large where you cannot adequately meet the needs of all children who are eligible for CCDF. If we can go on to the next slide. Okay, these are just some examples on the slide of some service areas that tribal lead agencies currently have, right? So you can see you could define this in a lot of different ways. You could define it based on a mileage radius from your community. You could say that the family has to have a permanent residence on or near the reservation, or you can include it by like counties, or say that individuals have to live in certain cities or areas. For tribal lead agencies, the consortia up in Alaska, I know there's a lot of you on this call, those service areas are pretty much set, right, under ANCSA, and so you could use your ANCSA service area It's really up to you to determine that. It's just important to keep in mind that it has to be on or near the reservation, or if you do not have a reservation, within a close proximity to where the tribal population resides. Okay, next slide. Okay, so these are some policy clarifications, and sorry for the heavy text. But these are some questions that we get asked all the time, multiple times in the child count session. So we just wanted to have them up here for you all so we can talk through that. So the first question is kind of specific to if you have a broad definition of your Indian child definition. So let's say you, in your Indian child definition, say that you serve all children or any child who's enrolled or eligible for enrollment in any federally recognized tribe, right? So you have a very broad definition of Indian child. You're counting all those children when you do your child count. Can you prioritize or limit CCDF services to your own enrolled tribal members? And the answer to that is no. So if you are counting all Native children, or if you have an expansive definition of Indian child, when you do your child count, you cannot restrict that definition or prioritize your own enrolled members. So that's really important when thinking through what your Indian child definition is for this child count session, or this child count period, to really kind of think through what are your priorities for your community, what are the priorities of tribal council, and if tribal council really, or your community really wants to prioritize your own enrolled members, you may want to tailor your Indian child definition so that would be allowable. But if you count all Native children or you have a broad definition, you're expected to serve all of those people. So can your CCDF program prioritize services for certain populations, right? So you can't do it in that one case, but you can prioritize services based on the needs of your community. So for grantees receiving a small CCDF allocation, aside from that, not being able to prioritize your own tribal members, you can prioritize however you would like to. For tribal lead agencies receiving a medium or large CCDF allocation, you must prioritize childcare services for children experiencing homelessness. And CCDF uses the McKinney-Vento definition of homelessness. And you must also prioritize care for children with special needs. Special needs is a term defined by the tribal lead agency. So any specific subgroup, you can include in that. So if you want to include children in protective services, children with developmental delays, children where the families are involved in like domestic violence counseling or substance abuse treatment, any subgroup, you can categorize within special needs and prioritize them for care. Our tribal lead agencies that have a medium or large allocation that also use categorical eligibility. So that's where you're waiving income, you're waiving job activity, eligible activity for the parents. You must also prioritize care for children with the highest needs, which again, that is up to you to tailor as you see fit to best meet the needs of your communities. All right, so moving on, can we serve, oh, no, sorry, Maddox. Yes. Can we serve children who meet our definition of Indian child if they live outside of our CCDF service area? So any child, when they're determined eligible, must permanently reside within the CCDF service area. So when you're determining eligibility, that child must permanently live in that service area. However, you can choose to serve families that are living temporarily outside of the service area. So if child is determined eligible, and then mom and dad leave the community, leave the service area to go to school, you can still provide that child with their full eligibility period. But when it comes time for that child to be redetermined eligible, that family again has to be permanently residing within the tribal service area. Let's see, and then can we pay childcare providers and our families choose providers outside of our service area? And you can do that. So service area is really linked to eligibility, which is based on where the child resides at the time of that eligibility determination. So you can pay providers who are outside of your service area as long as that family was inside of your service area at the time of determination or redetermination. And then I have two more FAQs that are not on the slide, but we were asked a lot when we did this training for direct funded grantees. If there are any tribal lead agencies that just use childcare as a wraparound for their Head Start, right? So you're only serving in that case children who are like birth to 5. But when you do the child count asks for a count of children up to age 13. So even though you're only serving children up to age 5 or within a certain age group, you still count all of the children that are birth through up to age 13. So 12 years, 364 days. So you still count all those children, even if you're not serving that full group. And then kind of along those same lines is we got asked at our training for direct funded grantees, can you use things that project your child count into the future, like birth rates or pending enrollment applications? And you cannot. So the child count is a count of children from birth up to age 13, so that 12 years, 364 days on the day that you submit it and the day that it's valid, right? So you cannot project based on birth rates, based on anticipated new enrollment applications. It is how many children meet your definition of Indian child on the day that you submit your count. And so that you can't like project into the future there. So super important that you are getting your data as best as you can at the time of submission. Yeah, and there are some questions in the chat, so let me just flip through those really quick because we set aside this. So there's a question in the chat about dual eligibility. So dual eligibility does not impact your Indian child definition or your child count. What dual eligibility does is it puts in a requirement on states that states cannot say, oh, well, this child can get served through their tribe, so we are not going to serve them. So dual eligibility does not put any requirements on tribes. It is something that is put on states and territories that says that they still have to serve children who are enrolled in tribes, even if that child can get services through their tribe or through another tribal lead agency. And then let's see, is there any guidance on non-tribally enrolled children who live in the service area where the tribal CCDF provider is the only provider? So, Jesse, I'm not sure, are you maybe able to come off mute and explain that a little bit more? Because I don't know if like, so you're asking, can the tribal lead agency, like the tribally operated center, serve those non-native children?
Yeah, sorry, this is Jesse Parklingenada. Yeah, we commonly serve non-tribally enrolled children in communities where there is no state provider or licensed provider, whether it's a facility, home, anything like that. But those children are excluded from our child counts, especially in our rural communities.
Yeah, so those children wouldn't be able to be counted in your child count. We can get back with, we'll touch base with Ray Bell or Carrie to get you kind of some more guidance on that for you. Okay, and then can you explain
I think that one will.
the count for consortium versus? Okay, yeah, and Rosa will address your question in a minute and a little later on. So does anyone have any questions really quick before we transition into like talking through data sources and CAR submissions? No, awesome. Well, thank you all. I will pass it over to Meryl. Hold on. Oh, you gotta do that.
I have to do that. So nobody heard my introduction. Sorry, we're having technical difficulties in the room here. Hi, everybody. My name is Meryl Borofsky. I'm a senior program specialist in the Office of Child Care, Division of Program Operations. And I work primarily on the tribal plan. So I am really excited to be here with you today. Now you can see me in two places. But I'm going to keep looking. Well, I'm going to keep looking at my computer because I have my notes. So next we're going to talk a little bit about your data sources and how you more information on how you actually do your child count. So after your definitions of Indian child and service area have been determined, the next step is really to identify your data sources. And there is no federal requirement regarding which data sources a tribal lead agency can use. You can use any federal, tribal, local, state data, but it's really important that the data used for your child count is both valid and reliable. And what we mean by that, and why Mike repeated so much about the importance of your definition of Indian child and service area, is that the data that you choose should match those definitions. So if you have a more expansive definition of Indian child that includes all enrolled members of any federally recognized tribe, choosing a data source that is just your tribal enrollment data would not be valid because it's not counting all of the children that you want to count. So you would want to look for a data source, maybe the census, or maybe another data source that has a more expansive definition. And then again, just reiterating what Mike said earlier, that you really want to ensure that the data you collected is an unduplicated count of children. So if you do have those overlapping service areas, you're communicating with the other tribal lead agencies to make sure that you're not counting the same children twice. And that I will go over in a couple slides, but the federal government does not have a definition of what conferring is. It is really up to you and your neighboring tribal lead agencies. And then, sorry, I'm in the wrong. Okay. And then something else, as we've said multiple times, you do not have to submit to us your data sources, your methodology, but really it is best practice and will make your lives easier in 3 years if you keep pretty good records of what you have done and the decisions you've made, what data sources you've chosen, things like that for your internal records. So if we can go to the next slide. Okay, thank you. So we strongly encourage tribes to have written policies and procedures for conducting the child count that document your methodology. So these are a couple examples that we have chosen to include that maybe you haven't thought of or maybe are part of your record. So the process for requesting the information, sometimes it takes a couple weeks, sometimes you can get the data pretty quickly. You want to write that down just so you're prepared. What data sources you're using, if you're doing any sort of calculation. So sometimes maybe the data source doesn't include children, up to 13, and you have to do some calculation to piece out those, the children you want to use in that data set. What are your methods to ensure non-duplication? Writing all that down, keeping records of that conferring. And then any processes for tribal certification. Do you have to do internally? Do you have to present to tribal council? Things like that. And then finally, just submission procedures. I'll keep saying this, you don't have to submit this to us. You don't have to submit this to the Office of Child Care, but it will really make things easier in 3 years when you have to do this again, to have this all written down, to know the timeline, and to know all of the decisions that you made. If you want to do the same thing or if you want to make changes in 3 years. So if we can go to the next slide. So as we have said, tribes may not count any child who's included in the child count of another tribal lead agencies. So you have to ensure that you have an unduplicated count. This image is just very rough display of what this could look like. So you could have those overlapping service areas, or you could have neighboring service areas. Coordinating with the tribal lead agencies that have neighboring or overlapping service areas is really important. You want to make sure that you leave enough time to work together and confirm that your counts are not duplicative. Through coordination and on receipt of data, it should be cross-referenced to ensure you're not duplicating the count. And it also supports your data accuracy and integrity of the data. So on the next slide, we have some examples. Like we said, we do not require specifically how you confer. We just require that you do confer. So these are all examples that have been used by tribal lead agencies. So having a formal memorandum of understanding, or MOU, communicating through tribal leadership, CCDF administrators directly working together, having in-person meetings or virtual meetings, having written communication, discussing different data sources, joint analyses of the same data sources, and discussing approaches to ensure non-duplication. I do just want to point out that we had a webinar in the fall, end of the summer, early fall of last year, that is on the TCBC website, which we're going to link at the end, where some tribal lead agencies actually shared their methods for conferring with their neighboring tribal lead agencies. And I would strongly recommend listening to that. It's really nice to hear what other tribal lead agencies are doing and how their approach to conferring. So in the next slide, here is just, again, another example of action steps that you could take for neighboring or overlapping service areas. So the first thing is identifying who those other tribal lead agencies are, and then identifying who to contact, conferring with the tribes, and then considering documenting the process. We can go to the next slide. Here is also, we just wanted to share some ideas for you all on what you might want to share, either during those meetings or in any MOUs. But it's really important, again, to share those definitions of Indian child in your service area. You might think that you have you might have overlapping service areas, but then realize that your definitions of Indian child, both of you have a narrow definition of enrolled children in your own tribe. And so actually, while your service area is overlapping, your definitions are not, and so you probably don't need to do the data checking that you would if you had an overlapping definition of Indian child. You'd probably want to share the data sources you're using, maybe any methodology, your overall approach for the child count, and then any other information that you think would be helpful in sharing. Okay. So this is an answer to a question that came in, and I'm going to go through a little bit more when I talk about CARS. But for consortia lead agencies, you must submit a child count for each member tribe, as well as a signed demonstration or declaration letter. There is a sample in Appendix 1A for tribal lead agencies with approved 102.477 plans. And that is for each member tribe. Just kind of a pause. If you are not a consortia, you will just input the number that is your child count. You do not have to upload any document. But for consortia, for every member tribe, you will have to upload that one signed document. So this is a change from the last round where you had to upload 2 documents. So hopefully that this is helpful in reducing that burden. And then again, all of the same requirements apply. So for overlapping service areas, you still must confer whether or not you're a consortia or not to ensure your unduplicated count. So with that, I'm going to pause, and I saw some questions came in through the chat before we go into CARS, which is how you submit your plan. And thank you, Lisa, for answering questions. Okay, I think I can't hear. Our plan includes children up to 18 with a documented disability. Can those children also be included in the count? So the answer to that is no. Your count is just, you can include children, you can serve children up to 18 with a documented disability, but you can't include them in your child count. Oh, and then I think Lisa has answered all of the other questions. Lisa, please break in. We'll go through the CARS. If anybody has any questions, please continue to put them in the chat. I think we will have time to answer any other questions. But
Meryl, there's someone that has their hand raised too.
oh, thank you. If you want to come off mute, Rosa, we can answer your question.
Yeah, it was also related to the question I had earlier with the child count and for consortiums. I know you said unduplicated child count. But we ran into an issue the last time we submitted our tribal child count, because we do overlap a service area with one of our tribes who receive their own CCDF funding. But we still had to submit a count for them because of like the discretionary per base versus mandatory.
Yeah. Mhm.
And so that's why I had asked the question, because we before that had not submitted the count for them. And then in 2022, when we did the triennial child count, we were required to submit the count. So it was quote unquote like a duplicated, but because we are a consortium and they are a direct funded tribe. And so that's why I had asked the question, because we did have to submit their count.
Yeah, that's a great question. I'm gonna pass it to Mike to answer.
Here is a, yeah, so, and for, this is for any of the Alaska lead agencies. So there is a rule that is attached to the Social Security Act, which is where we get our mandatory funds, right? So we have CCDF discretionary funding, which is most of our funding, and then we have CCDF mandatory funding. So in Alaska, CCDF mandatory funding can only go to Metlakatla and the regional nonprofits, right? So CANA can only be the ones to get mandatory funds for their region. So in that case, you have the one tribe that receives their own discretionary funding, but CANA receives their mandatory funding on their behalf. And so that's why there is that requirement for you to submit some kind of count for them. That count should meet your definition. So if that member, or if that one tribe has a narrow definition and just serves their own members, but CANA's definition might be more broad and serve all Native children, that count for that community should reflect your definition and not theirs. When you go to submit the form in that attachment 1A, there's going to be a box there. There's two boxes. One says we authorize the consortium to receive CCDF funds on our behalf. And that's the one that most of your member tribes should check. But there's another box below it that says we do not authorize the consortium to receive discretionary funds on our behalf. And we will, like, that tribe is saying that they receive their own discretionary funds, but you receive their mandatory funds, right? So it's really important that that one tribe checks the right box, because that's going to impact your funding. And that's going to be true for any of the consortium lead agencies up in Alaska.
Okay, thank you for clarifying that. That was my understanding and how it was explained to me the last time around, but I just wanted to clarify as we go into it this year, because it sounds like there have been some changes that that was still the way that we count it. So thank you for clarifying.
Yeah, and I realized that we didn't put screenshots of cars in, so I apologize, but there is actually two boxes for one for your mandatory count and one for your discretionary count. And this is for consortia, and I think, do you remember?
Yeah.
It's for any consortia. So if you are receiving the mandatory funding on behalf of a member tribe, but not the discretionary, you would include the child count number. Did I say that correctly?
Mm-hmm.
Okay, I always get it confused. So you would put then the number that you are, so I don't know, it's 100 for mandatory, but you're not receiving their discretionary. So then you just put 0 in that box. And then they would also fill out their own child count.
Perfect. Thank you. Thanks for that clarification.
Oh yeah, no problem. Thank you for asking the question. We, I know in Alaska, so if this is sounding confusing to anybody, who is not in Alaska, you can just ignore the last couple minutes because this is a kind of special situation in Alaska. So we can go to the next slide. Now we're going to just go over a couple pieces about the Child Care Automated Reporting System, or CARS. I don't know if any of you attended. We had a webinar this morning introducing CARS. We are repeating that webinar next Wednesday because CARS is now open for submission. This is where you're going to include all of the information that Dawn went over at the beginning of the webinar. So you can go to the CARS homepage. If you already have an account, you can just sign in, but you can also create an account if you do not have one. So you click the sign up button, and then what you will do is when you sign up, you will add the module, which is the child count and the 118A module, and then it gets approved and you'll be able to log into CARS. Yes, thank you, Rosa. If somebody, could somebody put in the registration information about next week's CARS? I will say the CARS webinar does talk broadly about the kind of all of CARS as well as the direct funded plan. So there might be some information for you if you do, that might not be relevant, but it is useful on like how to navigate and things like that. Okay, can we go to the next slide? Okay, if you already have a CARS account, but it's been a while and you haven't logged in and you need to recover your password, you can easily do that from the home page. So as a reminder, you will have to use a multi-factor authentication. So you have your username and password, and then a code will be provided via email or text. But if we go to the next slide, if you have forgotten that, oh wait, I'm sorry, if you could go back one, Maddox, I apologize. So if you have forgotten your password or you need to reset it, you can click on this text that is right under the next button, and that will show you how to reset your password. And then we didn't screenshot it, but there's also a place where you can select forgot your password. If we go to the next slide now. If that doesn't work, or if you have any other questions, the CARS email and phone number are on this slide. I will say the CARS CA team is incredibly responsive. They usually get back pretty quickly with any questions. And they are, especially they know this time until July 1 is really important. They are really going to help you really quickly. If you are having any trouble creating your account, logging into your account, if you can't reset your password, if you have any questions, I really highly recommend reaching out to them because they will be the ones to be able to help you quickly. Go to the next slide. Okay. Just these are, I will say, we have heard a lot of feelings about some of these requirements, and they are just, we apologize, but they are federal IT cybersecurity requirements. So you have to log into CARS every 60 days or your account will become inactive. If it does become inactive, we can always reactivate it, but you just have to jump through a couple more hoops. So you'll also have to log in every 60 days, and you also have to change your password every 60 days. Really important to log out of CARS after you've completed your session, because you might lock the page. Again, kind of cybersecurity rules. It's just best if you kind of totally log out, and then you can make sure that anybody else who needs to get in there isn't locked. We can go to the next slide. And then the one final piece about CARS, so you can submit you will submit your child count into CARS. There is one additional question. This question previously was on a PDF that you were uploading it, but we've made it a clickable box in CARS. It is just a question, if there is the option for reallotted discretionary funds, your answer to this question would allow you to be eligible to get those funding. So if any tribal lead agency is unable to spend or tells us that they're unable to spend their discretionary funds, it would be reallocated to all of the tribal lead agencies that say, yes, they are interested in receiving this funding. Tribal lead agencies with 102477 plans, we only ask you this question once every 3 years. So it's really important, if you are interested in getting these funds, that you click yes, so you are eligible if those funds are available. I will say some years they are and some years they aren't, but this would allow you to be able to potentially get that funding. Okay. Did you want, I'm going to pause because I saw that a couple questions came in. Is there a limit on how many staff that have access to CARS? I do not know that answer to that question. I think that we will ask the CARS team. I am not sure. But I don't think so. I think that a lot that usually oh, thank you, Stephanie. Stephanie is one of our wonderful CARS TA staff members. So
Yeah, the thing I was gonna throw in there, and Stephanie, you can confirm this too. I don't think it's a limit on number of staff, but we do only certain people are allowed to actually be the ones to submit it. And so you could have lots of people in working on it, but only a limited number of people are allowed to actually transmit the plan.
Yes. So there's a couple roles you can have in CARS. One is you're able to enter data, but then the final submit and certify is limited to somebody who has the authority to act on behalf of the tribe. Okay. So I will keep going. We wanted to, this is kind of taking a step back a little bit away from child count and CARS, but just wanted to provide a little bit of clarification on the in the past year, the CCDF rule changes for consideration. So as you might have heard, OCC published 2 updates to CCDF regulations in 2024. In March 2024, we removed the requirement for tribal lead agencies to have a sliding fee scale and to follow generally accepted payment practices. Sorry, I'm distracted by the chats coming up. And then in November of 2024, we removed the requirements for tribal lead agencies to consider a family income for eligibility. I will say both of these are optional. But we wanted to make sure that you all are aware of these. These are no longer requirements, and that you can, if you would like to make changes to your program, that might need to be reflected in an amendment to your 102477 plan. Okay, if we could go to the next slide. So we also just wanted to include a slide about the 102477 plans and amendment reviews. We will continue to work with the VIA to meet the review timeline specified in the MOA. And that tribal lead agencies may continue to request TA or support from OCC through BIA. We are still here and we have a wonderful TA provider who can support you all. And I think with that, that might be the last slide. Yes, thank you. So we have 2 QR codes on the slide. One is just to get OCC updates. The other is the Tribal Childcare Capacity Building Center, TCBC, has resources that you can look at their website and see any resources. But we still have time. We are here. I'm going to check if anybody has any questions, we'll check the chat, or you can come off mute and we are happy to answer any questions.
Maybe while we see if anyone has any questions, I'm gonna hop in just because I was looking at the participant list and I know that some of our BIA partners are on the call. And I just kind of want to reiterate the last point that Meryl made on the last slide. The Office of Child Care is definitely here to help work with all of you. But as 477, we definitely want to partner with our BIA colleagues. And so if you need any assistance with any part of this, please make that request of your AOTRs, and then they can reach out to me and my team will help support all of you. So we've undergone a little bit of. So actually, Lacey, you just put this in the chat. So we are not going through our regional offices anymore. So please contact your AOTR and then they will connect. We have a team of staff in central office. We underwent a loss of staff with a department reorganization at the beginning of April. And we do not have enough staff to staff all the regions in the way that we did in the past. And so we have transitioned the 477 work where we have a team of folks in our DC office who is supporting the 477 work. So if you reach out to your AOTRs, they will connect with me and my team, and then we'll be able to provide you with the support.
Maddox, can we put the QR codes back up on the screen?
You see the question. Somebody asked, who is their AOTR? If you don't know,
Yeah, and Carrie just put her information on the chat. For if you did have any questions related to your 477 plan, she said that you can reach out to her.
Thanks, Carrie, for putting that in. And yeah, I defer to Carrie and the BIA colleagues to let you all know who your individual AOTR is. I don't want to get that wrong.
thematic.
Is it okay if I chime in real quick?
Yeah.
It's Carrie.
Please.
My name's Carrie McMillan. I work for the Bureau of Indian Affairs, Division of Workforce Development. I am one of, let's see, we're up to 6 specialists, 5 specialists. If you don't know who your awarding official technical representative AOTR specialist is, feel free to email me. I dropped my email in the chat and I will let you know. Brandy, I'm not sure what your who you're affiliated with, but feel free to email me and I'll let you know. Thank you.
Thanks, Carrie. And I have not known what that acronym is meant for the last 4 years. So I wrote that down so I won't forget.
Oh, I'll just mention that the awarding official is the person that moves the money and we are their technical representative.
Makes sense. Did anyone have any other questions before we close out?
I think one recommendation we have is see if you can log into CARS sooner rather than later. Just so that you, well, it's really important to be working on your child count now too, but you also don't want to get to late June and realize you can't log in. And so that shouldn't take long, but also the CARS TA team will probably be getting a lot of requests at that time.
Thank you, everyone.